Hello, everyone. I'm Arya, your host, and welcome to today's live session. Well, if you are Indian origin living in US and your parents are visiting from India, you do not need to worry about their medical needs in US. eGlobal Doctors has your back. They have different packages for you, starting from $199 that provide access to 300 plus doctors from US and India with 30 plus specialties. Prescription will be provided and they get back to you within 1 to 3 days of time. Family members can participate live via video physician consultation from any part of the world. The video consultation is about 30 minutes. They have also introduced a very affordable nutrition and health section for diet consultation, which gives you the chance to talk to the expert nutritional coaches. We'll tell a bit more about this in the live here, so stay with us till the end. In today's live session, we'll be exploring and providing more information about various disorders from thyroid. And to help us understand all about this topic, we have our eGlobalDoctors expert endocrinologist, Dr. Rajashree Nambron. She is a consultant endocrinologist at University of Texas Health Center. She has been practicing endocrinology since last 6 years in US. She has her direct specialty care tele-endocrinology practice in US as well. She did her fellowship in endocrinology at Case Western University, Cleveland, and University of Alabama at Birmingham. She has earned the membership of Royal College of Physicians at London after practicing in England for 5 years, and also has published a book chapter of thyroid nodules. She's currently involved in a startup for multicultural women's health through midlife. Welcome to the live, Dr. Rajashree. Pleasure to have you with us. How are you doing today?
I'm doing great, and thank you so much, Arya and eGlobalDoctors, for this endeavor that you're doing for the people in India. And thank you so much for having me here.
Thank you. So as our topic says that we are here to discuss about the thyroid-related disorders. So let's dive right into the topic with the basic question, like what are these thyroid disorders?
So I've made a few slides. So let's do a slide share. All right. So basically thyroid disorders, first I would like to explain what a thyroid gland, where it is located. So it is a gland that is a butterfly-shaped organ in the front of the neck, and it releases the hormones, the thyroxine, which is T4, and triiodothyronine, which is T3, that is the active form. These hormones are very important in the regulation of our energy levels, the internal body temperatures, skin, hair, nail growth, and also the metabolism in general. It's an important part of the endocrine system. So the main thyroid disorders are, if you have an underactive thyroid, it's called hypothyroidism. If you have an overactive thyroid, it's called hyperthyroidism. Just want to show the pictures of the thyroid gland. So the one on the right side is the normal size thyroid gland, the butterfly shaped gland. And the one on the extreme left from your side. So if you look, it is enlarged. So that's called a goiter. And on the middle is a thyroid gland with a nodule. So we'll talk about all this in detail in the next few slides. So too much thyroxine or too little thyroxine can cause health problems. So if you have too much of the thyroid hormone released from the thyroid gland, that is called thyrotoxicosis or hyperthyroidism. So the cause of thyrotoxicosis or hyperthyroidism can be from the inflammation of the thyroid gland, or it could be an autoimmune cause, or it could be a nodule or tumors in the thyroid gland. So sometimes the thyroxine can be produced. I mean, thyroid gland produces too little thyroxine, and that is called hypothyroidism, and it can cause problems in individuals with relation to development if it occurs in childhood. So we'll talk more about the symptoms in the next few slides. So hyperthyroidism. The most commonest cause of hyperthyroidism is Graves' disease, which is an autoimmune condition. So the symptoms can be anxiety, irritability, nervousness. You can have bulging eyes, as you can see in this picture. swelling of the thyroid gland, which is called goiter, a difficulty in swallowing. You can have a irregular heartbeat or a rapid heartbeat. You can have menstrual irregularities. Most thyroid problems are more common in women. It can cause sometimes infertility, sweats, difficulty in sleeping. If you're pregnant, can cause excessive vomiting, frequent bowel movements, weight loss, heat intolerance. You always have to ask for a family history of thyroid problems. So hypothyroidism, the most commonest cause in the developed world, it's mainly Hashimoto's hypothyroidism. It's also an autoimmune condition. So the symptoms of hypothyroidism are forgetfulness, again, irritability, moodiness, depression, inability to concentrate, thinning of hair or hair loss, puffy eyes, again, swelling in the neck sometimes. Because of the swelling in the neck, you can have some hoarseness, you can have some difficulty in swallowing, again, menstrual irregularities. Usually in hypothyroidism, it is heavy menstrual periods, loss of body hair, dry skin, infertility, constipation, weight gain, cold intolerance. Sometimes cholesterol problems can also occur in hypothyroidism. So a thyroid nodule is when there is a lump felt in the thyroid gland, localized lump. So it can be because of fluid-filled cyst or a growth of the thyroid tissue. Nodules are common and usually seen in older age group. And usually nodules, they may not be symptomatic. And sometimes when the nodules can be large, that can cause pain or hoarseness or problems with swallowing or breathing. Most of these nodules are benign, means not cancer, but a small number of nodules can lead to harbor a thyroid cancer. So about 8% of the nodules in men and 4% of the nodules in women could be cancer.
So if we can get to, yeah, sure, continue.
So some of these thyroid nodules, it could be cysts, like as we explained before, it could be just fluid filled liquid inside them, and that can sometimes be large and that can cause discomfort. Sometimes you can use a needle to drain it, or it could be you need surgery to remove, or you could do some ablation techniques if it is very symptomatic. Solid thyroid nodules, mostly they are benign. Sometimes they can be a cancer in these solid thyroid nodules, and usually it needs to be evaluated with a thyroid ultrasound scan. Some of these nodules, if it is overproducing thyroid hormone, it's called a toxic adenoma. And sometimes you may need a special scan like radioactive iodine scan to see if it is a toxic adenoma. So most common cause worldwide for the nodules is the lack of iodine in the diet. What was your question?
Yeah, good. So thank you for explaining and elaborating everything in detail about the symptoms and what small things we need to look out for. But then what is the main cause of these thyroid-related disorders?
Yes, so some of these thyroid-related disorders, the main cause, it could be either autoimmune, like in developed world, or it could be from iodine deficiency, usually seen in South Asian countries, sub-Saharan African countries, or in the Middle Eastern countries, there could be iodine deficiency. Autoimmune cause is actually the autoimmune cells in the body acting against each other and causing the thyroid to produce more thyroid hormone. That's called Graves' disease. And if there is a failure of the thyroid gland, that is called because of the autoimmune process, that's a Hashimoto's hypothyroidism. Sometimes there could be thyroid problems from radiation exposure. Sometimes the patients may have had surgery of the thyroid leading to hypothyroidism. Sometimes they would have used some medications like amiodarone or lithium, and that can cause thyroid problems. Some of these other causes are, again, nodules, again, related to iodine deficiency leading to nodules. Sometimes there is no cause for nodules. A family history should be looked out for. Thyroid cancer, some genetic disorders can cause thyroid problems, and sometimes pregnancy can be the start of a thyroid problem.
So let me tell our viewers and listeners here just a moment that we are live on Facebook as well as on Instagram. So log into your favorite social media and ask your questions in the comments, and we'll make sure to answer them right in this live here. So Dr. Rajashree, we did talk about the symptoms and then what are the main triggers causing these thyroid issues. So if you can elaborate more about what are the types of these problems?
So the types of thyroid problems, it could be hypothyroidism, hyperthyroidism, or goiters. So as we discussed earlier on, hyperthyroidism is when there is an overactive thyroid gland or overproduction of the thyroid hormone. And hypothyroidism is when there is underproduction of the thyroid hormone, or if it is an underactive thyroid. And sometimes there could be inflammation of the thyroid gland. A goiter is an enlargement of the thyroid gland, and sometimes there could be nodules on the thyroid gland. And sometimes these nodules can be benign, or there could be a cancer in these nodules.
Okay. So then these thyroid disorders, can they be sometimes mistaken for menopause? Like how to differentiate between that?
So usually, sometimes what happens is when they have irritability, sweats, palpitations, or rapid heartbeat, usually these sometimes women feel that these are a forerunner of perimenopause or menopause, and sometimes they can have no periods because of overactive thyroid. So the way to distinguish this is by doing a blood test to look for thyroid problems. That's called the thyroid stimulating hormone, free thyroxine or free T4, and total T3, which is total triiodothyronine levels. These are blood tests that are used to look for thyroid problems. Sometimes the endocrinologist can do other tests like antibody panel for the thyroid called the anti-TPO antibodies, thyroid stimulating immunoglobulin, or thyroglobulin antibodies to see what the cause of any of these thyroid problems are.
Okay, great. So the blood test would be majorly the differentiator.
Yes, a blood test is the one to differentiate. So, and the patients need to go to their doctor and get this checked and not believe that this could be menopause. First, get checked for all the other causes.
Correct. So are these thyroid disorders curable? Like what are the treatments one should undertake?
So the thyroid disorders, they are treatable. Some of them, there is a cure for thyroid problems. Like for example, if you have hypothyroidism or underactive thyroid, after doing blood tests, you will need, again, I'm going to need the medications like levothyroxine. It's usually a daily pill that is given first thing in the morning in empty stomach, and you need to be careful taking this medication at the same time, and also do frequent blood tests to see if the levels are appropriate. And once you take your thyroid medication, you need to make sure that you're not taking other medications like calcium, iron, or stomach medicine like the omeprazole and things like that, along with the thyroid medication, because it will affect the absorption of the thyroid medication. Some of the trade names of the thyroid medication in India, I think it's Thyronorm. Here it's Synthroid, Utherox, Tirosint, Levoxil. These are all the thyroid medications that are given for underactive thyroid or hypothyroidism. And so like I said, these things, other medications like calcium, iron, and antacid medication should be taken several hours apart. The overactive thyroid or hyperthyroidism is usually treated with a medication called methimazole, antithyroid medication, or propylthiouracil. Propylthiouracil is usually used in the first trimester of pregnancy and in women who are breastfeeding. Again, we need frequent blood tests to monitor the levels of the thyroid when you're on these medications.
So, as you listed all the medicines here, so can these thyroid medications cause any side effects?
So thyroid medications like levothyroxine, if you're taking too much, it can cause symptoms of hyperthyroidism, like palpitations, or that means rapid heartbeat, or weight loss, sweats, and anxiety or restlessness. And it again can also sometimes cause, it can also cause bone loss if you're taking too much of the thyroid medicine. If you're taking too less of the thyroid medicine, it can cause symptoms of hypothyroidism, which is again weight gain, feeling tired, hair, skin, nail problems. So basically, we need to do blood tests to make sure that your levels are adequate. And when you're taking methimazole and medications like propylthiouracil, you will have to let your doctor know that you're on these medications, because it can sometimes cause low blood count or neutropenia, and can be a setup for infections. These medications can cause rash or allergies, and cause problems with the liver enzyme elevation. So you have to be careful with medications like methimazole and propylthiouracil. And I also want to let people know that the treatment for thyroid nodules are, sometimes you can just monitor them by doing ultrasound evaluations frequently. Sometimes when the nodules are growing, you may need a needle test or a biopsy to see if there is any cancer. And if the nodules are so enlarged, or if there is any symptoms of compression, like problems with swallowing, breathing, then you may need a surgery to take the thyroid out. Some conditions like the overactive thyroid or the Graves' disease, and sometimes the thyroid nodules which are overactive, you can cure it with radioactive iodine therapy. So it is a capsule that you swallow, and it is combined with with iodine and radioisotope. So the thyroid gets all the iodine and burns the thyroid tissue, so thereby treating the overactive thyroid.
Okay. So then, and about these side effects, do they cause any interference with a pregnancy?
So usually when the thyroid problems like hypothyroidism or hyperthyroidism are not treated, then they can cause problems. There's a risk of miscarriage, premature birth, or low birth weight in babies who have uncontrolled Graves' disease or hyperthyroidism. In patients with babies, in women who've had babies when they are not treated, when their hypothyroidism is not treated, these babies can be stillborn or premature, and babies can have lower IQ if the mother's hypothyroidism is not well treated. So again, in pregnancy, you need close monitoring and follow-up for any kind of thyroid condition.
I see we have a question on Facebook. Someone has asked, like, why is hypothyroidism more prevalent in women?
So both hyper or hypothyroidism, they are more common in women. It is just that probably women have more, like they can have more autoimmune conditions. So that's why, because both the hyper and hypothyroidism are most commonest cause is autoimmune.
Yeah. So coming to our last question here, what foods to avoid for thyroid patients, and what changes one should make in their diet and exercise if they have?
I want to take one moment and just let our patients, the people know that there are two emergencies in thyroid disorders. That's called myxedema coma, which is like if you have very untreated hypothyroidism, you may end up in the hospital with hemodynamic compromise, which is can cause heart failure and even death. So it is an important thing that you need to take your thyroid medicine if you have hypothyroidism. Another condition is untreated Graves' disease or inadequately treated Graves' disease or hyperthyroidism can have hemodynamic instability and be admitted to the hospital. It's called thyroid storm. So again, patients need to be very careful that they take their medication and consult with their doctors or endocrinologists if they have these conditions. So coming to your question on diet, so usually in countries like the US, there is no iodine deficiency, but about half, like I was reading a paper, about 40% in India, the children, they are still not used, or people in India, 40%, they're not still using iodized salt. So they have iodine deficiency. So in such conditions, we want to make sure that their iodine intake is appropriate. And so iodine deficiency can cause hypothyroidism. I want to bring up that slide here. And also too much iodine can worsen hyperthyroidism, especially some people take iodine supplements, too much seaweed, kelp, or shellfish, molasses, they can cause too much iodine in their body. That will worsen if they already have the hyperthyroidism or overactive thyroid. And some patients, when they are undergoing radioactive iodine scans or therapy, it is important to do a low iodine diet because that will help better uptake of the radioiodine. That will help in their treatment and diagnosis. Caffeine, like especially regular coffee, regular sodas, and energy drinks, they have a lot of caffeine. They can worsen the overactive thyroid symptoms. And like I said before, countries like South Asia, Africa, and Middle East, they can have iodine deficiency that leads to goiter and hypothyroidism. So some of these dietary products, like the cruciferous vegetables, they have glucosinolates, and cassava, lima beans, sorghum, they have thiocyanates. They competitively inhibit the iodine, compete with the iodine for thyroidal uptake. So that leads to the goiter and hypothyroidism. Smoking is harmful in both hyper and hypothyroidism. Sometimes people use soy-based formula without adding iodine. That can cause hypothyroidism in infants. And unclean drinking water, industrial pollutants, they all have some chemicals that can lead to hypothyroidism if they have iodine deficiency in that area. But none of these can cause problems if the iodine is adequate. Some of these vitamins like the selenium, iron, and vitamin A, they are important in helping with the iodine uptake in the thyroid. So it is important to have these micronutrients. So some of the things that have selenium are Brazil nuts, spinach, oat. Then you all know what is iron-rich foods, vitamin A in all these yellow foods. So these are the important things to remember in diet.
So while we are on the topic of proper nutrition, let me tell our viewers about the new diet consultation. We have different categories about diabetes remission, detox program, weight loss, child nutrition, gut health, menopause nutrition support, and many more, where we help people understand the root cause of the problem and provide suitable and healthy solutions as per their dietary requirement and lifestyle habits. So register yourself today on www.eglobaldoctors.com to get the personalized nutrition coach for you. So Dr. Rajashree, I see we have another question on Facebook. Someone is asking, is medication the only solution for thyroid?
So some thyroid conditions, like, for example, some people, they have like the thyroid tests. When they do the thyroid test, depends on why you did the thyroid test. So if they can be normal, but their antibodies can be positive. So in such cases, you don't need medications. There is a whole other group of people who think that some of these plant-based diet can help with reducing the autoimmune antibodies and leading to the thyroid antibodies being negative. Like there's a body of thought from lifestyle medicine groups who think that plant-based diet can help improve such situations. But once you have a thyroid condition where your thyroid stimulating hormone has become abnormal and you have either low or high thyroid hormones, then you need to take medication.
Okay. So with that, it's a wrap. I don't see any more questions on Facebook or on Instagram, but you can still, even after the live ends, you can still comment down your questions or queries, and we will reply back from Dr. Rajashree as well there. So thank you so much, Doctor, for taking time from your busy schedule and contributing to a valuable session on thyroid disorders. It was very informative, and I'm sure it must have cleared so many questions for everyone watching this live. Thank you so much.
Thank you.